Hey guys, this is Donald with Zynex Medical, and today we're talking about pain. We're going to talk about what is pain. We're going to talk about what are the different categories or types of pain. How do we rate pain? How is it currently treated in the medical world? And then where do we fall in? How does Zynex play a role in the treatment of pain? So the International Association for the Study of Pain defines it as an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. So really, let's just break it down. Pain is terrible. Pain is debilitating. Pain prevents you from shaking another man's hand at a board meeting because of your carpal tunnel syndrome. Pain is preventing you from dancing with your spouse because of your lower back pain. Pain is preventing you from kicking the soccer ball with your grandchildren because you just can't move that fast or your feet hurt. Now, how do we categorize pain? You've got what we call acute pain, that is a new onset. That can include everything from I fractured my arm today, I fractured my arm 5 days ago. It becomes chronic when that patient's been suffering for 3 months or longer. That's usually the number that is identified as chronic pain in the medical world. So we at Zynex, we treat both. We are treating acute pain, an injury that just came in. They start physical therapy in a week, or they've been doing physical therapy for 5 months, or now they're at a pain clinic, and now we're treating chronic pain there. So that's acute versus chronic. We also have what's called musculoskeletal pain. That is obviously pain involving the muscular system or the skeletal system. We also have what's called neuropathic pain. That is pain that's a lot of diabetics will describe it, like burning and tingling going down both my legs, decreased sensation in both of my feet. Those patients are prescribed gabapentin a lot. Those patients might, not always, might require a significant higher amount of milliamperage on their next wave compared to other patients. So if we're doing demo days, we need to be rating our patient's pain. And how we do that in the medical world is 0 out of 10, how bad is your pain? 0 being no pain at all, 10 being the worst pain of your life. Because if we can't measure pain, then we can't report it back to anybody. So if I can say that this patient was a 7 out of 10, and now they're a 3 out of 10 after using the next wave for 40 minutes, I can then go to that provider and say, hey, just to let you know, Mrs. Smith in room 8, she said she lives at a 7 out of 10. She said she's now a 3 out of 10 after using the next wave. She said that's the first time she's been a 3 out of 10 in years. So how is pain treated in the medical world at the moment? There can be prescribed NSAIDs. That is a non-steroidal anti-inflammatory drug, such as Motrin, Toradol, Naproxen. Those are all meloxicam. Those are all different types of non-steroidal anti-inflammatory drugs. When you're educating providers about the benefits of the next wave, yes, we're talking about opioids a lot, but we can also say things like, with chronic NSAID use, we have kidney injury, we can develop gastric ulcers, and then you're going to have to prescribe them another medication to help them with their gastric issues. They're also going to be prescribed muscle relaxers such as Flexeril. I don't know about y'all, but I've taken a Flexeril in the past and I was loose as a goose for probably 12 to 16 hours. It took away my pain, but I slept. I slept almost the entire time. So you can use it, but then you can't drive. You can't operate machinery. You can't even watch a movie with your friends because you're going to be so tired. And then one of the last ways that they do treat pain in the medical world is opioids. So that's going to be everything from a Norco or Vicodin, which is a combination of 5 milligrams of hydrocodone and 325 milligrams of Tylenol. It comes in one tablet. And if medications like that are not working, those are the patients that are now being prescribed morphine, fentanyl patches, Percocet, oxycodone, and these medications come with their side effects. I always joke around and say, if you go into a nursing home and say, raise your hand if you're constipated, every single person would raise their hand because a lot of the patients in the geriatric population are on opioids, and one of the major side effects of opioids is decreased gastric motility, which is a fancy way of saying things move slower through your intestines, which makes you constipated. So it's a big side effect of opioids. And obviously the major side effect of opioids is respiratory depression. That is what kills a patient when they overdose. They take too much morphine or any of these opiate categorized drugs, and their respiratory rate decreases and until they stop breathing. Where does Zynex play a role in all this? Why are we here? Why was the next wave even created? Well, we are being able to relieve these patients of pain without chronic NSAID use causing gastric ulcers, without chronic Tylenol use causing liver injury, without chronic muscle relaxer use. So we're decreasing patients being sedated and tired all the time. And then obviously reducing opioids. That's our main goal, is to reduce opioid use in the patient population suffering from pain. So with a non-invasive, they're stickers, non-addictive, it's just electrical stimulation, and no side effects, like I just mentioned, the complete opposite of everything that they've been being treated with for weeks or months or years. These patients are not just being relieved of pain, they're now getting their life restored. They're able to do exercises and activities that they haven't been able to do in a very long time. Or even if their pain has been treated so that they're kind of able to do an activity, well, their side effects from their drugs have them so tired or drowsy that they don't feel like doing anything. So that's our talk on pain today. If you have any questions, please reach out to your area sales manager.